So the pathology of measles virus. So there is measles, we know it affects the respiratory tract predominantly. So once it affects the respiratory tract, it causes a necrosis of the respiratory tract epithelium. So any viral rash, for it to cause a rash, there should be some vasculitis, and most often the vasculitis is a small vessel vasculitis. It can cause both exanthem and enanthem, right? Exanthem is on the skin, enanthem is in the mucous membrane. So the small vessel vasculitis can occur on the skin or in the oral mucosal membranes. So this is the histopathology of the rash. So we can see there is disc keratosis pictures and many giant cells. So this is these are many cytoplasmic infiltrates and many epithelial cells. Inflammation is there. This large cell over here with multiple nuclei. So this is called as the Warthin-Fickeldy giant cells, which is pathognomonic for measles. There is there can be even up to 100 nuclei can be seen in this Warthin-Fickeldy giant cells. So there are so many cytoplasmic and intranuclear inclusion. So this is the histopathological picture. Okay. So coming to the pathogenesis. So what happens in the incubation period? So usually once the virus gets exposed to the skin and mucosa, it goes into the regional lymph nodes. So here it is predominantly the oral mucosa and the conjunctival mucosa. It goes to the regional lymph nodes, that is the cervical lymph nodes, and it causes a viremia. So in the initial viremia, what happens? The virus settles down in the reticuloendothelial system, and from there secondary viremia starts, where the virus gets settle over the skin and the mucosa. So it gets settled over the skin, causes replicates in the skin, causes the small vessel vasculitis resulting in a maculopapular rash, and it replicates in the oral mucosa, causes the Koplik's spot. So exanthem and enanthem. Then comes the second phase, which is this is the incubation period. So next is the prodromal phase. So in the prodromal phase, there is conjunctival suffusion, there is coryza, sneezing, snuffles, etc. So in this prodromal phase, what happens? It causes epithelial necrosis, especially in the respiratory tract. So epithelial necrosis happens, giant cell formation will happen, viral replication and shedding. So this is where the transmission from one person to another person starts, even in the prodromal phase. So next is the exanthematous phase. So there is a rash, generalized rash, maculopapular rash, starting from the face and then spreading over the entire body. So this exanthematous phase is when the symptoms begin to subside. The prodromal phase symptoms will begin to subside. Rash will become very, very significant. Here the antibody will start getting produced and act against the virus. The final stage is the recovery stage. So the 4 stages: incubation period, prodromal stage, rash, the exanthematous phase, and the recovery phase. So the initial target for measles virus will always be lymphocytes and the dendritic cells. And then respiratory epithelium is where the predominant attachment happens. So they get expressed over the trachea, mucosa, nasopharynx and the lungs. So this is where the sloughing or the necrosis of the epithelium happens. So incubation period is somewhere between 8 to 12 days, say less than 2 weeks only. There is a prodromal phase. What is this prodromal phase? What are the clinical features of this prodromal phases? There can be a mild fever. Following it, there will be sneezing, secretions, that is coryza is there, a prominent dry cough, conjunctivitis. So all these are seen in the prodromal phase of measles. Next comes the exanthematous phase. In the exanthematous phase, before the exanthem, there will be Koplik spots. So the Koplik spots are nothing but, these Koplik spots are actually the pathognomonic sign of measles. So even before the onset of rash, there will be Koplik spots. So these Koplik spots are nothing but red lesions with white spots in the center. Okay, so usually it is seen in the oral mucosa. It can be seen in the oral mucosa, the inner side of the cheeks, that is the buccal mucosa. It can even be seen in the conjunctival and the vaginal mucosa. So when we carefully see, we can see at the level of the premolars is where the Koplik spots are usually seen.